This is Gerry Samson in Atlanta, Georgia. Today, I thought I'd speak with you about the reality of dental change with age, facial change with age. Every single shred of evidence that we have seen in our evidence-based orthodontic and dental culture has led us to the conclusion that teeth shift with age. It all shifts with age. Wrinkling skin, wrinkling teeth. Now, of course, this is not what anyone wants to hear. It's certainly not what patients want to hear. But whether an individual has had orthodontics or not, teeth shift with age. Wrinkling skin, wrinkling teeth. This is particularly true of the lower arch because the lower teeth are trapped by the maxillary dental arcade. And we also know from the remarkable studies done by Rolf Gordon Barentz, Growth in the Aging Craniofacial Skeleton, that as the face changes with age and the upper and lower incisors upright with age, because of the trapped lower arch, these lower incisors upright, the inner canine width becomes more narrow. That would be from the research of Robert M. Little. And whether a patient has had braces or not, the lower incisors will change with age. What's the solution? Well, the solution involves various options that we can offer to patients. One option is clearly to continue to accept that the lower incisors shift with age. No retention. Another option is lifetime bonded lingual wire retention. If you will take a look at the most recent information published by the excellent blog Kevin O'Brien's orthodontic blog, and I think you will see a reference to that somewhere along the line here in this information. You can click on that reference and read a guest editorial. The complications that are now arising after bonded lingual 3-3 retainers have been in somewhere between 3 and 5 or more years. Some of these wires become activated and can result in rather serious and embarrassing results of roots torquing through the facial cortical plate and torquing through the lingual cortical plate. Bonded lingual 3-3 retainers are certainly imposing when it comes to the responsibility. Who bears the responsibility? Is that the orthodontist? Is it the general dentist? Has the patient been informed that it is their responsibility to maintain this lower bonded lingual retainer, and if they see anything whatsoever which is out of the ordinary, to visit their dentist, their pediatric dentist, their orthodontist, and check to see what is going on before it becomes more severe? Is there a written informed consent form signed by the patient that they understand that responsibility? Well, frequently there is not such an informed consent form signed for fixed bonded lingual 3-3s, resulting in some question of responsibility, if not liability. What's another option for crooked lower incisors, whether the patient has had braces or not? Some patients never had orthodontic treatment, but their complaint has to do with shifting of the lower incisors with age. I don't really like the term relapse unless it's combined with the fact that there was previous orthodontics and that teeth shift with age. Well, what's another option? Retreat the patient with fixed appliances. Probably not the best thing, not what they want to hear, or treat them for the first time with lower incisor brackets only, limited treatment. What's another option? Another option are the clear aligners. These have become very sophisticated and very appealing over the years. Fairly remarkable things can be done with clear aligners. The downside of that tends to be the cost involved. These tend to be very, very pricey aligning systems, upper or lower. Another option is to just leave it alone and the teeth will continue to shift with age. Probably not what the patient really wants to hear, but that would be the reality of the ethics of informed consent. Yet another option are spring aligners, removable spring aligner, Hawley style retainers. Most of us have been, we have seen mixed results with those things. Some okay, some not okay. And obviously there's some improvements that need to be done. Well, after more than 35 years of private practice and seeing all of these things, I think most of us doing orthodontics have come to the same conclusions, that the teeth shift with age. Et voila! A remarkable development in alignment for upper and or lower incisors, the Apex Revolution Spring Hawley design. This is made of beta titanium. It's exceptionally flexible and very, very well designed. It fits quite nicely, and it has these beta titanium springs that have excellent memory. This is what you see for the treatment of the patient that's being pictured here. This was a patient I treated many years ago, decades ago in fact. She did not wear her retainers. She admitted that. And she was not too happy with the movement of the lower incisors, and certainly was not excited about going back into fixed appliances. She was also not excited about hearing that the teeth would continue to shift if she didn't do something, whether that be some sort of retainer to hold them still. As you can understand from the latest publications as well as my comments, I'm not a huge fan of bonded lingual 3-to-3 wires because of these complications that have come up. And I presented her with the option for a lower, of course this one is a maxillary, a lower Apex Revolution beta titanium spring retainer. I explained to her she would have to have excellent, consistent cooperation, and I explained the interproximal reduction, IPR as it's called, slenderizing the teeth, in detail, and had her sign an informed consent that she agreed and understood that, as well as ask questions about the enamel reduction. There was minimal enamel reduction in this case, but there was astonishingly good compliance. Patient was highly motivated, and what she wanted was limited orthodontic treatment. What you are seeing is a limited end result. It's certainly not a detailed finished result, but it's what the patient wanted, and she consented to and signed forms for a limited orthodontic treatment. The Apex Revolution Spring is how that was done in 3 months. It would be difficult for me to believe if I hadn't seen that, again with minimal IPR. This is a very appealing option. It's appealing because it works. It's also quite appealing because of the fit of the appliance, that it is one, perhaps two appliances depending on the degree of crowding. It's also very appetizing from a cost standpoint and the business and overhead standpoint of performing orthodontic treatment. Clear aligners are very effective. They're also quite costly, especially compared to the Apex Revolution Spring from QC. I think you will be absolutely delighted with this appliance. Jay Bowman and I are quite enthusiastic about it. The QC Apex Revolution Spring Beta Titanium, a superb development in alignment of upper and lower incisors.